Good evening. My name is Adrienne Black, and with me tonight is Monica English, Amanda Strickland, and Monica Stuckey. We are here to discuss the importance of training programs for lactation consultants in low-income communities. You may be wondering why we think breastfeeding is so important. Not breastfeeding has increased risk to both mothers and infants. For infants, there's an increased risk of infectious morbidity, including otitis media, gastroenteritis, and pneumonia, as well as childhood obesity and type 1 and 2 diabetes. There is also an increased risk of infant leukemia and sudden infant death syndrome. For mothers, there is an increased risk of premenopausal breast cancer, ovarian cancer, type 2 diabetes, metabolic syndrome, and retained pregnancy weight. The importance of all this information is that these are modifiable, preventable risk factors that can be extinguished through the simple act of breastfeeding. American College of Obstetricians and Gynecologists recommend exclusive breastfeeding for all infants under the age of 6 months, with continued breastfeeding through at least their first year of life.
There is abounding evidence supporting the benefits of breastfeeding. Some of the most crucial benefits are presented here. Breastfeeding protects the vulnerable infant against many health concerns, including diarrhea, ear infections, necrotizing enterocolitis, pneumonia, respiratory infections, asthma, type 2 diabetes, obesity, and SIDS. It is also one of the most effective health interventions. Breast milk is an unmatched source of perfect nutrition for infants. Research estimates that as 90% of infants in the United States breastfed exclusively for 6 months as recommended, the U.S. would save $13 billion per year and prevent over 900 deaths. Breastfeeding provides nutritional, immunologic, environmental, and psychological benefits. The longer duration of breastfeeding provides increased protection. As being healthcare providers, we are interested in the medical aspects of breastfeeding. But there are many long-term benefits to breastfeeding that you should also be interested in. Breastfeeding is significantly and positively associated with educational attainment, independent of early social background, that is largely accounted for by an increased cognitive ability at age 15. There is also an association between breastfeeding and an increase in reading ability, timed visual search, and verbal memory at age 53. These potential long-term benefits of breastfeeding can impact an individual's life course, with its influence on childhood cognition and educational attainment.
Healthy People 2020 set goals to increase the rates of infants in America who are breastfed. And so as you can see by looking at this, what we want to focus on mainly is exclusively breastfeeding. And at 3 months, the goal for Healthy People 2020 is 46.2, and we are currently at 44.4. And at 6 months, exclusively breastfed infants, the goal is for 25.5, and we are currently at 22.3. So as you can see, we've got quite a bit of increase that we need to do with exclusively breastfed infants. Research shows that a combination of breastfeeding peer counselors and international board certified lactation consultants increases breastfeeding rates and duration. Peer counselors are mothers who have been involved in the WIC program. They also have experience breastfeeding, are trained on the basics of breastfeeding, and often share the same culture, language, and socioeconomic status as those mothers they help. IBCLCs have extensive training in lactation education and breastfeeding management. They manage complicated breastfeeding issues such as slow weight gain, failure to thrive, tongue tie, premature infants, and those infants with neonatal abstinence syndrome. The Centers for Disease Control uses the ratio of IBCLCs to live births as a quality indicator to measures breastfeeding support. In 2006, there were 4.57 IBCLCs for every 1,000 live births in the United States. And as you can see, that is really low. So we need to increase our IBCLCs so we can support more breastfeeding mothers. The WICS pilot program, we want to grow our own lactation consultants, and we can use federal funding to develop a comprehensive lactation education program for WIC peer counselors to complete IBCLC education certification requirements. work with local colleges to create effective educational programs, and will also provide expertise available to lower socioeconomic and vulnerable populations. Benefits of increasing lactation consultants. Women counseled by IBCLC are 4 times more likely to exclusively breastfeed their infant at 1 month and 3 times more likely to exclusively breastfeed their infants at 3 months. Healthy People 2020 goal for initiating breastfeeding is 82%. Women that receive lactation counseling at least attempt to initiate breastfeeding 95% of the time. So increasing the number of lactation consultants will also increase the prevalence of breastfed infants.
This is what we need from you. We are asking you to increase federal funding to the grants provided to the WIC program. Help us develop more lactation programs and provide scholarships to WIC peer counselors. Funding lactation programs through WIC increases the number of IBCLCs available to vulnerable populations. Since WIC peer counselors already reflect the culture, language, and race of the population they serve, helping them become IBCLCs will bring expert breastfeeding support to this vulnerable population. Thank you for your time, and please consider supporting this issue and the health of the infants and mothers of our country.